I was 38 when I was diagnosed with stage 2 invasive ductal carcinoma.
I'm currently going through treatment for stage 3 breast cancer.
I was diagnosed with breast cancer when I was 38 years old.
I am a 20-year breast cancer survivor.
Went to my very first mammogram. And when I went, they said, well, you have really dense breast tissue. And I didn't know what that meant. So I think the first thing I asked was, well, does that mean that I'm fat? And they said, no, that doesn't mean that. That just means that you have some fibrous tissue and we want to send you for something a little bit more in depth. So 6 months later, I went back and there was no changes. And so felt good about that. Okay, there's no changes. We're just going to continue to track it. And then went back 6 months later. And at that point, it was palpable. Like I could feel it. I knew it was there. But in my mind, I just thought, well, if we're just tracking it, it's not anything.
Actually found out on my wedding anniversary. I am 15 years clear of breast cancer. And my cancer was due, how I found my cancer, it was due to an injury. Me and my husband attended a certain church and he wanted me to go to another church because he played drums at. I didn't want to go and I was like, I don't want to go, I want to go to my own church. So thank God that I did, because when we were packing up his drum equipment, I fell down some stairs of the stairs of the church. Days later, a lump developed on my left breast. Didn't think anything of it. I thought maybe it was the injury from one of the parts of the equipment that I was holding for him. Weeks went by, it started growing. It grew so big that it seemed like it was like a third boob. So I started wearing layered clothes up under my scrubs to try to hide it because you could see it protruding through my clothes. From then on, I was scheduled for surgery. So when I went into surgery, I woke up to my husband and my doctor in tears. And I was wondering what was wrong. I was like, what's wrong with y'all? You know, never expected anything. And my husband told me, he was like, hon, you were diagnosed, you have breast cancer. And I was like, no, I'm thinking I'm under anesthesia, joking, like, okay, I'm still sleepy, no problem. But the doctor nodded his head. He said, I sent it to pathology while you were still under, and it's stage 3.
I found my lump myself. My mom is also a 35-year breast cancer survivor. So with her having gone through the journey, she's always taught me to do my self-breast exam. So one night, I was getting ready to get in the shower and I did my exam myself and I found a lump. Went to the doctor and found out that it was cancer. So the journey began from there.
I'd been doing self-examinations because my mother's a breast cancer survivor. She had been diagnosed 2 years prior to me. The really scary thing about having found my breast cancer was I went to get a mammogram and an ultrasound. I was told that it was benign, that it was a cyst. They sent me on my merry way. And of course, being 38, I figured, yeah, back to life. I'm busy anyways, no time for this. But 6 months later, it ended up doubling in size. And when I came back and finally had a biopsy, that's when they told me that it was cancer.
I'm Jade. I am a women's health nurse practitioner, community health. I just have to start by saying that you guys are all inspiring and amazing. Listening to your stories not only help everybody in the community as to what to look for, but it helps me as a provider as well. And, really listening to our patients. You guys were all diagnosed with breast cancer before the age of 40. And so I think that's a big takeaway for me as a provider, and listening to your body and being consistent and speaking up for yourself. And thank you for sharing your stories. The bottom line, screening is important. Mammograms are important. Self-breast exams are important. And if you have any questions or any doubts about anything, don't wait. Go talk with your provider, schedule an appointment. And you guys are amazing.
We got it.